Thank you, Elizabeth, and thank you for allowing Dr. Coke and I to share with you today. Does that volume sound about right?
Turn it down
just a little bit. Okay. So I'm Dr. Lynn Mikel, and I work at the Natural Health Clinic of Des Moines. Dr. Coke is now the new owner of the clinic, and we've been there, well, I've been in Des Moines about 20 years. Dr. Coke and I have worked together for about 6 years, 6 years. So we were asked to speak on anxiety and depression, or the neuroendocrine system. So my goal for you tonight is to take away at least 2 interventions that you can use for yourself or someone that you're thinking about or wanting to help. And you know, when I go to a continuing ed class, if I can take away 1 or 2 things that I integrate into my practice and use, then I think that's successful. So I know a lot of you, some of you are my patients and some of you are Dr. Coke's patients, so we really appreciate your support. So I guess I'll get started here. We're talking about anxiety and depression, how to feel happy and calm. That was a vacation. That's where I get my happy and calm on. I hope you do too. And that's one thing Dr. Coke and I do take quite a few vacations. As if you're my patient, you know that. But we like to practice what we preach. And I don't think we take enough time for self-care and relaxation. This is still our little therapy dog at the clinic. And a lot of people come in just to say hi to her. I think she does give us kind of a little bit of hit of nature, I could say. She is very calming presence, and she definitely makes me smile multiple times a day. So I'm going to talk a little bit about the neuroendocrine system. What is that? I'm going to talk a little bit about how genetics, environment influence our mood. I'm going to talk about the language of emotion. I'm going to talk a bit about our thoughts and how our reality, conscious and unconscious, shapes our worldview and interacts with our biochemistry. And then at the end, I'm going to give you a few practices or ideas about things you can do as interventions to help your mood. But I was going to say something else about that. Oh, one thing I was going to say about that is, you know, naturopathic medicine really is holistic. Allopathic medicine, more the traditional medicine, really is more linear, like cause and effect. So, you know, you get an infection, you get sick, right? But a naturopath really looks at the whole body. And when we talk about the whole body, if somebody gets sick, we talk about their immune system, we talk about nutrition, we talk about the mood they're in or the stress they're under. It really is multifactorial. So when we talk about the mood, anxiety, and depression, it's not linear. I'm going to talk about hormones, I'm going to talk about your gut, I'm going to talk about your emotions. So that's the difference. And naturopaths are really taught to look at underlying cause. So often people feel that who they are and what they bring to us is more fully appreciated than when you go to a medical doctor and, you know, okay, here's the antibiotic. Hope you get well. So it's the same for the mood. I guess I bring that up because it's not, it might be a little disjointed, or we might be presenting a lot of ideas, but they're all interrelated. And that's kind of the challenge and the skill of a naturopathic doctor. So when we talk about our mood, about 50% they say is genetic. You know, we have a constitution, we come with a personality, so you have to appreciate that some of our set point for being depressed or anxious or being happy and calm really is, you know, we kind of are born that way. But there's a lot of influences on genetics, and we'll talk a little bit about that more toward the end. Our circumstances, the environment we're in, will shape that. What happens to us, you know, who we marry, for example. How happy are we, you know? And then also our internal state of mind. And that happens to be habits that we have emotionally, perceptions, our attitudes, and even practices. So there's a big influence on our mood, and we're not just, I guess, at its mercy, which sometimes that's how it feels, especially if you are depressed or anxious. And so when we talk about the neuroendocrine system, we're talking about the nervous system, which is the brain. And the brain is where we make all those neurotransmitters, serotonin, dopamine, and the endorphins. And then the peripheral nervous system, which influence our peripheral muscles where we move, but also some of our internal states of digestion, how the heart functions, for example. The endocrine system, on the other hand, is where we make our hormones. So the endocrine system starts with these glands in the body, the pituitary and the hypothalamus, the pineal gland, and this is our perception of stress in the environment, what's coming at us. This is how we interpret that. And then that down signals to the adrenals, which are these two little glands over your kidneys. That interacts with your thyroid, that interacts with your sex hormones and your insulin. So it's very, we're interconnected. And when we're developing as infants in utero and childhood, maybe up to 6 years old, those two systems, the neurological system and the endocrine system, really are developing together. So if you are a baby and you are in a sort of chaotic environment, maybe you have somebody who's unkind to you or rough with you, there's a lot of startle, a lot of anger and noise in the house, you cry and you're hurting and nobody attends to you, you can imagine that the nervous system might be on high alert, right, if you don't know what's going to happen next. And some babies will be in a state like that long enough where at some point they just get subdued. They don't call attention to themselves. So an influence like that can cause the nervous system to kind of be wired for anxiety, or if it shuts down, wired for being depressed, subdued. So that influence is definitely related to your environment. And then you compare that to a baby who cries, who's hungry, and their needs are met. They're soothed. Of course, they have distress once in a while, but they're comforted. Things happen in a pretty timely manner. A baby like that, their neuroendocrine system may develop to be a little more balanced, a little more regulated. So it really, this initial influence, like I say, even in utero, can impact how we develop as adults. When you're in that state of fight or flight, being mistreated or not attended to, it can cause a lot of fear, it can cause the muscles to be tense, it can cause you to have a heightened sensitivity to pain, versus somebody who's in an environment where the love hormone oxytocin is flowing, the endorphins are more soothing. That person then has a more regulated sense of pain and their muscle tension is more normalized. So some of what we develop into as adults or even young adults is really influenced by this early development. So the other thing that influences children is kind of the environment of the people around them. The kids pick up, we as kids picked up the feelings of our parents. Maybe we had a mom who was anxious, or a dad who was angry, of course using my own example. So, you learn from that. And when you have feelings, they're designed to be a guidance to you. They're designed to help you know if you should go toward that or away from that. And usually, or very commonly as children, especially in my generation, we didn't have much language for emotion. I just knew I felt good or bad until I was about 25. Then I started tweaking that out a little bit more specific. But, a lot of times kids don't have a language. Sometimes we don't have time to give our kids the attention when they have an emotion to help them process that. And then if that happens, it becomes internalized and becomes a part of the body. And so somatization or somatize means to manifest psychological distress through a physical symptom. And many times, or many symptoms, can be a result of internalized emotion. So common symptoms that are there because we have emotion that we haven't really processed or acknowledged: headaches, a lot of stomach stuff, joint pain, pelvic pain, sexual dysfunction, and back pain are just a few examples. And some of you may have heard of Louise Hay. She does the book, on associating body symptoms to an emotion, trying to be more specific. And I think she talks about low back pain being stress about finances, and maybe the neck and shoulders more about holding responsibility. I'm sort of guessing at some of these as I recall. I have a sty, for example, tonight, so I looked up what that meant with Louise Hay, and she said in anger, and I kind of worked on that myself a little bit and did a little bit further than anger, tweaked that out a little bit to being rejected. And so I kind of thought about it. I've had 4 sties this year, like why all of a sudden? And there's someone I'm angry at. And it kind of motivated me to start not really looking at the anger. I think once you're aware of the feeling, it's easy to let it go. But I think to be more motivated to forgive and go on. So I don't want to keep getting sties. I'm going to try to forgive this person. And they didn't do it intentionally, so anyway, that's just an example. But, I said to Charlyne, I think we're teaching what we're trying to learn ourselves. And it's, I think, I shouldn't say women. Women are emotional, so are men. But it seems like emotional states have this sort of global effect on women. It affects everything, how we work, our relationships. So the inner work is really important. And I've really learned that the best way to heal people is to do my own healing. So I'm pretty authentic in that way. So there is this relationship between the gut and the mind. We already talked about that people who have anxiety often, it can settle in the digestive system. But when we talk about these emotions, they're triggering biochemistry. And the gut and the brain are actually really interconnected. We know that at least 80% of our serotonin is actually made in the digestive tract. And we think of serotonin, or I do, as this chemical in the brain that affects happiness. All the antidepressants just about that, most of them that they use now are working on serotonin. But one thing that is unique for naturopaths, you come and talk about anxiety and depression, and I'm going to first start talking about your gut. What are you eating? Do you have constipation? Do you have diarrhea? Do you have gas, bloating, indigestion, heartburn? Because if the gut is unhealthy, that 80% of serotonin, some of which is actually sent to the brain, is going to be disrupted. So that's a really important point. These two are so integrally related. Also, the healthy bacteria that flourish when you have a healthy gut then also help to produce some of these neurotransmitters and hormones that affect our brain. So the gut bacteria won't proliferate, won't be there if you're eating a bad diet, like, can of Coke or processed food, which I know none of you do that because you're here at Marlene's Market. You're eating vegetables and healthy protein. But again, this disruption in the gut health, leaky gut or inflammation in the gut, has a direct impact on our mood. Now, when I was young, I would say 12 or so, 12 to 14, I would wake up in the morning, and the first thing I would do would be to check in with my body and wonder if I was going to have a bad day or a good day. And I could tell by the way I felt. I felt like I was at the mercy of my body. I had no idea why. Some days I felt like ready to get up, had confidence, and other days I just wanted to stay in bed. And I felt sad. So I think this it sort of led me to not want to eat, because I felt like when I didn't eat, I could be more assured my mood was going to be better. And so I went down that road of, playing with anorexia and then a little bulimia, and I can admit that there was probably some psychological work that had to be done, but I'm also convinced eating disorders and addiction even probably have, for many people, a very large percentage of it is this imbalance in the gut. the gut flora, and then how that's affecting our nervous system and our endocrine system. So this is, this is a really effective way to make an impact if you start having the knowledge and skill to start improving your digestive health. And I've done talks on that here, and I'll probably do another one at some point if I'm lucky enough. So, and naturopaths, that's our forte. So, get some personalized work with that. Remember, serotonin is the neurotransmitter. I said 80% made in the gut, but does work, work in the brain to make us feel happy. But it also has to do, if it's deficient, with contributing to obsessions, compulsions, and depression. And dopamine is the neurotransmitter, neurochemical in the brain that has to do with focus. So a lot of kids with ADD or adults with ADD, often it's the dopamine that's deficient. It's usually high in the morning, and stimulus is alert, being able to focus, concentrate, but also pleasure and reward. So I would say happiness. And norepinephrine, epinephrine also kind of to wake you up, help you feel alert. And also as a naturopathic intervention in lieu of antidepressants, we often look at the nutrition that helps to support making those neurotransmitters. Remember, all of those neurotransmitters, well, maybe you don't know this, are made from amino acids, which come from protein. So some people are very deficient in protein, or they have a disrupted gut and they're not absorbing protein very well. And so the amino acids that make the neurotransmitters, if they're not there, they'll be depressed, right? They can't make it. So this is a slide showing that tryptophan, the amino acid, makes serotonin. Tyrosine will go on to make dopa. And GABA actually is an amino acid by itself, which is sort of the calms the mind. That neurotransmitter is kind of balancing the stimulating ones out a little bit. But unique to naturopaths, we get 3/4, we get 3 years of chemistry and 3/4 of biochemistry, and allopathic doctors get 1/4 of biochemistry. And so what my point is that we learn how nutrition interacts to rebuild our body and to make these structures. We're really just this little pool of chemicals, and we're directing it with consciousness, but a lot of our emotion is triggering that. But you can see for making serotonin, you need iron, magnesium, zinc, B6. You need a lot of nutrition. And again, if you have a leaky gut, you're not absorbing well, guess what? You could be really deficient. Maybe it's zinc that you need, or maybe you needed some of the B vitamins. Maybe you could make serotonin, you're getting enough protein, but you're missing some of those minerals. A lot of that has to do with eating processed food. Really where we get minerals are whole foods. So, it really is true. Our fruits and vegetables and healthy grains are really the way we're going to get that nutrition. And supplements. Naturopaths, we try not to overdo it, but sometimes we have to supplement what you're not getting from your food or able to digest. A little repetition there. Stress is a big picture. How am I doing for time? Pretty good. Stress, is a good thing, right? It's motivating. It helps us show up. It helps us get things done. But I would say for probably all the patients I see, I don't know one patient that I see who isn't stressed out. And so, it tends to be our culture, I think. Maybe it's because we're in a big city. I just went to Portland, and I can feel a different energy in Portland. It seemed calmer there. People were more engaged, a little more present. And I think some of it is we're in a bigger city here. A little bit less maybe on the south end, but stress really can be a problem if it's too much. And usually it is too much for people and impacting their happiness and causing anxiety. So when we have stress, the hormone that's triggered is cortisol. That again is from those adrenal glands. And cortisol is designed to get blood sugar mounted, so your muscles can fight or flight. You can run or you can fight the tiger. And every time that sugar is in the bloodstream, insulin is upregulated. And then, and also the continued state of stress is very nutritionally demanding. and over time can start causing some of those nutritional deficiencies I was talking about. Even if we're overweight and have gained excess weight, many people are nutritionally deficient in the minerals that keep that stress reaction going. So the body's interesting. When we start breaking down from stress nutritionally, the body will do things to counteract that. And it'll put weight on. It'll put weight on around the middle because it wants to spare your visceral organs like your heart and your lungs and your kidneys. And so this weight starts going on around your middle. As a result of that high insulin, insulin resistance, estrogen can be upregulated to calm that stress down. Estrogen is also a growth hormone, will put weight on. And so we get trapped in this dilemma of these hormones being out of balance. And many people come in with mood problems or anxiety or depressions, somewhere on those continuum. And they think it's their hormones. I'm pretty sure there's some hormone involvement. Maybe it's worse at a certain time of month. Maybe their hormones are waning. And they're absolutely right. Part of it is their hormones. But again, remember, it's not linear. It's kind of this interaction with everything going on. And as much as we get mad at our body, darn, why am I gaining weight so easily? Or, you get stressed out about it. Your body is doing everything it can with the wisdom of your genetics to try to keep you going. And a lot of times our thyroid will start becoming resistant to thyroid hormone, our metabolism will slow down, and that's exactly what the body's trying to do, slow you down so you can rest, you can take a break, you can get more sleep. But, of course, in our culture, we tend to just, give me a drug or a hormone or more caffeine and I'm going to keep going. I don't have time for that. And I'm true too. I'm guilty of that too. But, some of you might know I went through an experience with breast cancer, and, that was about 15 years ago. But that was a big wake-up call. My body's going to break down if I don't pay attention to it. And I had gone through a lot of stress, medical school. I'd lost a husband to cancer. So, yeah, there was some things I couldn't control. But, I feel like in the last 15 years, I have more vitality. So, you can go through stressful events. There are things that you can't control. But when you have an ability to control some of those things, do it. Because, your body, you really appreciate it when you have to start cutting it up and you see people die. So. Again, our hormone balance, I just like to always talk about that because there's a reason things are going out of balance. Naturopaths are designed to think about it that way and help the body get back into balance. And we generally say 1 month for every year you've had the condition to try to improve something. So if you've been a type A personality for 30 years and you want to get your adrenals better, you better be focused on that for like 3 years. It's not going to happen in 3 visits. It's not going to happen in 3 months. It's going to be a lifestyle change. And then you really see the improvements. And I would have to say that's the biggest thing I've learned more now as an experienced doctor. Don't give up. Just keep at it. Give it enough time. If you are patient and are pursuing interventions that are appropriate, you will eventually see the difference. So we're going to talk a little bit, Dr. Coke is going to talk a little bit about these neurotransmitters, some of the supports we use. She's going to also talk about she and I are private labeling with Justin, our video person back there. We're putting a line of products together. She's going to talk about that. And of course, the products that we're starting out, we have, about 20 products now, but the ones that we are most interested in tend to help mood and the neuroendocrine system because that's such a big impact on the whole physiology of the body. And if you feel better, you're more likely to follow through with your treatment plan. So I will pass the baton here.